Hi, Kylie. Welcome to my Health Talk series, episode 1. Can you introduce yourself to the audience?
Sure. So, hi, my name is Kylie Gerhardt. I am a registered dietitian. I work currently at NYU Hospital, and I also work at an outpatient private practice called New York Nutrition Group here in New York City. So, I've been a dietitian, I think, 7 years now. Worked primarily in hospitals and also just like counseling patients on the side. I do a lot of that too.
That's amazing. Yeah, people nowadays, they really need dietitians because they're stuck at home. I don't want to call it stuck at home, but they're at home and they really, really have to maintain healthy diet, but it is challenging, don't you think?
So a lot of my clients, of course, we switched to virtual appointments now. So it is really important to keep up with your dietitian, and because it's a tough time right now. Everyone is basically stuck in their house, supposed to be stuck in their house
Yeah.
basically the entire day. With some of my clients, I've actually found that it's been good for them. They aren't as stressed out with work. There a lot of people at work, they have like snack drawers or like candy
Mhm.
baskets, so they feel like they're not snacking as much and they can actually take more time for themselves. But the other side of it is I see a lot of people who are really struggling with it, especially those people who never used to cook. So all the restaurants are closed. And you can order delivery, but I think it's just really expensive to keep ordering delivery, especially in New York City. So a lot of my clients who have never cooked before, it's a lot of working with them and trying to just teach them like very basic cooking skills and ways to prepare their food at home and stuff like that. So that's, I think, the biggest challenge for a lot of people is knowing what to buy and how much and like what
Yeah.
types of foods they should buy, and um, just trying to like put together some meals on their own, I think, has been the
And it
biggest
is
challenge.
also costly, right? Yeah, that would be great if they could learn cooking. What kind of diet you would advise in order to support the healthy immune system?
So basically, to support your healthy immune system, you don't want to go on any type of like crash diet. This is not the time to be dropping tons of weight, because when
Mhm.
you are in that calorie deficit, sometimes it can weaken your immune system. So my weight loss clients, maybe a pound a week would be healthy, but I'm not encouraging anyone to like go on these crazy diets where they're cutting out all food groups. So what you really want is a variety of foods, every color, every food group, if it's okay with you and you can tolerate it. Specific nutrients that support a healthy immune system are vitamin C. So vitamin C is in a lot of citrus fruits. It's in tomato, oranges. It's also in a lot of green vegetables, so that's a good one. And then zinc has also been shown to really support a healthy immune system. So that's in a lot of meat and a lot of seafood. Even anything with antioxidants, so a lot of fruits, vegetables, specifically like beets or any kind of colorful berry is usually really rich in antioxidants.
Mhm.
And then vitamin D too. So if you do dairy, if you can have some dairy, if you can maybe get outside and get some sunshine, as long as you're at a socially distant,
Very important. Yeah,
if
indeed.
you're not too close to people. But yeah, and then but if you don't do dairy, there's a lot of foods that are fortified with vitamin D. So those are just a few nutrients that have been shown to really support a healthy immune system.
Not to think that it prevents COVID-19. Some people, they're misled and they take some supplements or you know vegetables like garlic.
So, yeah, we always say, food first. You should always try to get all of your nutrients from food. If for some reason you don't eat certain food groups that I just mentioned, you can always take a general multivitamin, but there are a lot of false there's a lot of false information. Taking these mega doses of these vitamins can actually be harmful. If you take too much vitamin C, that can cause some GI, gastro distress. If you're taking too much vitamin D or zinc, that can have adverse effects. So you don't want to be super loading on all of these vitamin supplements. It's not going to prevent you from getting the virus if you're exposed. So maybe if anything, I would say just, a recommended dose from your doctor if you're deficient in something, or maybe just a general multivitamin every day just to make sure that you're covering your bases. But I do not recommend, these super doses of anything, or eating full cloves of garlic, or
Yeah,
or anything.
everything within the norms, right?
Yeah, yeah.
Um, what else? So it is known as well. There's some evidence that whatever you eat, it really affects your mood and the way you feel. Is that true?
That's definitely true. People who are vitamin D deficient can actually have like higher instances of depression, or even seasonal depression. That's why that occurs usually during the winter, or the more like the darker months of the year when the sun isn't out as much. So I strongly encourage anyone, and a lot of people are vitamin D deficient actually. So it's always good to try to get outside if it's a sunny day, at least for like a half an hour. Just get, soak in some sunshine. That's a good way to get vitamin D. Also, like I mentioned, from dairy or anything that's fortified with vitamin D is another good source. But there's certain foods that have shown to kind of improve your mood. I think for some people it might just be their favorite food, which is totally fine. If it's, once in a while you want to have like a slice of pizza. But watermelon is one of those foods. I think a lot of like the fruits. So yeah, anything with
That's why I
antioxidants.
love watermelon.
Yeah,
So yeah, that's true.
yeah,
Actually. I agree.
yeah, it's refreshing and it makes you feel good. So I definitely encourage any of those foods too.
That's great. Is there anything you would like to add?
I really have just been trying to encourage my clients to take this time for yourself, because when do we ever have, full days at a time to just stay home? So I know that it is definitely stressful, and that some people might still be working from home. But I do think in general, most of my clients have a lot more time on their hands. So instead of using that time to, be obsessed with the news or to worry, to really try to use that time for the better. Whether that's, cooking something new, or trying a new recipe, or organizing their spice cabinet, or arranging their fridge, or anything like that. So, just think about before all this, how busy you were and how you had no time to do anything. And now you have all the time in the world. So, and there's all these at home, workouts and stuff like that, ways to stay active. So I'm just trying to help my clients see the positive in this. Although it is a pretty negative situation, there is some good that can come from it.
Yeah, and the problem, I just remembered one question. People are overbuying foods, and it's sometimes uncontrollable for some people. What you would advise how to control and buy wisely?
So I think the best way to do that, especially since you probably want to limit the amount of times you're going out or going to the grocery
Mhm.
store, is to try to buy a lot of food that's shelf stable and that can be used in a lot of different recipes. So instead of maybe buying a bunch of fresh fruits and vegetables, you can buy the frozen options, which are actually cheaper, and they still have, a good nutritional value, maybe not as good as the fresh, but pretty close. So anything that's frozen, anything that's canned, anything that has doesn't need to be refrigerated. So a lot of like canned beans, or like they make pasta out of anything these days. So out of chickpeas, like chickpea pasta or lentil pasta. And if you do buy a bunch of fruit and you can't eat it all, you can always freeze it, chop it up, freeze it, put it into smoothies or something like that. So just trying to get stuff that isn't going to spoil quickly before you even get the chance to figure out how you're going to eat it.
I'll take that advice as well.
Yeah.
Thank you very much for joining me.
Yeah, of course. Thank you for having me, and I hope everyone stays healthy and safe.
Stay healthy, and of course, stay safe. Thank you so much.
Yeah, no problem. Bye.